Demikian tadi persembahan multimedia. Pengisytiharan pelantikan Pro-Chancellor.
Ladies and gentlemen, the proclamation ceremony of Pro-Chancellor will begin.
Majlis mempersilakan Yang Berbahagia Datuk Profesor Dr. Nik Rahimah binti Nik Yaakob, Naib Chancellor Universiti Metropolitan Asia untuk mengumumkan pelantikan Pro-Chancellor.
We now would like to invite Yang Berbahagia Datuk Profesor Dr. Nik Rahimah binti Nik Yaakob, Vice Chancellor of Asia Metropolitan University, to announce the proclamation of the Pro-Chancellor.
Yang Teramat Mulia Chancellor, saya memohon izin Yang Teramat Mulia Chancellor untuk memulakan pengisytiharan pemasyuran Pro-Chancellor. Your Highness the Chancellor, I seek permission from Your Highness to commence the proclamation of Pro-Chancellor.
Dengan kuasa yang diberikan kepada saya, maka saya mengisytiharkan pelantikan Pro-Chancellor Universiti Metropolitan Asia kepada Yang Berbahagia Dr. Devi Prasad Shetty. With the power vested to me, I hereby proclaim the appointment of Dr. Devi Prasad Shetty as Pro-Chancellor of Asia Metropolitan University.
Dr. Devi Prasad Shetty is a world-renowned cardiac surgeon in Bangalore and chairman of the Narayana Hrudayalaya Group of Hospitals, India. Born in 1953, he completed his graduate degree in medicine and postgraduate work in general surgery at Kasturba Medical College, Mangalore, before moving to the United Kingdom for his education. After attending basic training in cardiac surgery at the West Midlands Cardiothoracic Rotation Programme, he trained in cardiac surgery at the Guy's Hospital in London between 1983 and 1989. He returned to India in 1989 and initially worked at B.M. Birla Hospital in Kolkata. Later he moved to Bangalore and started the Manipal Heart Foundation at Manipal Hospital, Bangalore. Dr. Shetty is a professor at Rajiv Gandhi University of Health Sciences, Karnataka, Bangalore, and professor of International Health, University of Minnesota Medical School, USA. Dr. Devi Prasad Shetty has a long list of achievements. In 2001, he founded Narayana Hrudayalaya, a multi-specialty hospital in Bomasandra on the outskirts of Bangalore city, Karnataka state in South India. Apart from cardiac surgery, Narayana Hrudayalaya also has cardiology, neurosurgery, pediatric surgery, hematology and transplant services, and nephrology. Even patients from developed countries have been flocking to this hospital because of the high quality and affordable treatment. A state-of-the-art trauma hospital, Sparsh, and an ophthalmology hospital, Narayana Nethralaya, are part of Narayana Health City. The Health City houses a centre for neurosciences, a children's hospital, a cancer research centre and general hospital. Dr. Shetty also founded Rabindranath Tagore International Institute of Cardiac Sciences, RTIICS, in Kolkata. Dr. Shetty and his team have performed over 70,000 major heart surgeries. He has pioneered operations for complex problems of the heart like pulmonary endarterectomy, redo heart surgery, valve repairs in newborn babies and aortic aneurysm surgeries. He is the first heart surgeon in India to perform neonatal open heart surgery. He is also the first surgeon in India to use an artificial heart and use microchip camera to close holes in the heart. He operates on children under 12 for free, and a major proportion of his operations are on children. In Kolkata, he was the doctor for Mother Teresa. Dr. Shetty is credited with introducing Yashashvini, a health insurance scheme provided at very nominal rates in collaboration with the government of Karnataka. He has single-handedly brought down the cost of many complicated heart surgeries, bringing them within the reach of many people. Dr. Shetty also manages the world's largest telemedicine program through the Indian Space Research Organization, ISRO, ISRO, and a chain of rural clinics in Karnataka and Uttar Pradesh. Dr. Shetty and his team have a mission to make healthcare affordable to the masses living in third world countries. His awards and recognition namely are Rajyotsava Award in 2002, Sir M. Visvesvaraya Memorial Award in 2003, Ernst & Young Entrepreneur of the Year in 2003, Padma Shri Award for Medicine in 2004, Dr. B.C. Roy Award in 2003, Citizen Extraordinaire Rotary 2004, India Innovation Award 2004 by NDTV and EMPI awarded to Micro Health Insurance Division, Social Entrepreneurship Award World Economic Forum 2005, Indian of the Year 2010 awarded by NDTV in 2011, The Economist Innovation Awards for the Business Process Field in 2011, Padma Bhushan Award for Medicine in 2012. Today, ASEAN Metropolitan University proclaims Dr. Devi Prasad Shetty as a Pro-Chancellor of ASEAN Metropolitan University in conjunction with our 6th Convocation.
Terima kasih kepada Yang Berbahagia Naib Chancellor.
Thank you, Yang Berbahagia Vice Chancellor.
Majlis dengan ini menjemput Yang Berusaha Dr. Devi Prasad Shetty untuk menerima watikah pelantikan daripada Yang Teramat Mulia Chancellor.
We would like to invite Dr. Devi Prasad Shetty to receive his watika from Yang Teramat Mulia Chancellor.
Menjunjung kasih Yang Teramat Mulia Chancellor.
Thank you, Yang Teramat Mulia Chancellor.
Dengan segala hormatnya, majlis menjemput Yang Berusaha Dr. Devi Prasad Shetty bagi menyampaikan ucapan sebagai Pro-Chancellor Universiti Metropolitan Asia.
It is a great pleasure to once again invite Dr. Devi Prasad Shetty to deliver his speech as the newly proclaimed Pro-Chancellor of Asia Metropolitan University.
Morning. Can I have the PowerPoint presentation? Yeah. Her Highness Raja Dato Shri Azurin Binti Sultan Azan Shah, Chancellor of Asia Metropolitan University, Tan Sri Dato Alimuddin Haj Muhammad Dome, His Highness Tunku Dato Seri Kamal bin Tunku Rijauddin, Dato Sri Dr. Edmund Santara, Dato Professor Dr. Nick Rahimat bin Nick Yaqub, members of the Board of Directors, I'm extremely grateful to you for giving me this honor of Pro-Vice Chancellor. I'm privileged to be perhaps the first Indian to receive this award, for which I'm extremely grateful to Her Highness and the Board of Governors and all of you assembled here today. I accept this honor with greatest humility for the future generation, the younger generation of this planet. I am a cardiac surgeon by profession. I operate on newborn babies, little babies. But I have a very interesting job. My job is putting price tag on human life. Now you must be wondering what kind of a job it is. Every day I see about 60 to 100 children in my outpatient. A typical patient of mine is a little baby on a mother's lap. I examine the child and I tell the mother that your baby has a hole in the heart and he requires an operation. She looks at my eyes and asks me one question. You know what that question is? How much it is going to cost? And I tell her it is going to cost 80,000 rupees, which she doesn't have. And that is the price tag on the kid's life. You come up with 80,000 rupees, you can save the child. If you don't have 80,000 rupees, you're going to lose the child. This is what we do in all the developing countries from morning till evening, putting price tag on human life. 65 years after the independence to my country, if privileged people like us are given the right to put a price tag on human life, we have failed as citizens of this world. We talk about the human right violation. This is the greatest human right violation. As younger generation who are stepping into this profession, how long you are going to accept it? Things have to change. And who's going to change this? No angel from the heaven will come and change it. It's you who have to change. In the next few minutes, I'm going to explain to you how we are trying to make this change in our own modest way. But you people, once you realize this has to be done, it can be done. The topic I have chosen is heart surgery for $800. Today we are able to do a major heart operation for $1,700. We want to bring it down to $800. When that happens, entire healthcare scenario of this world will change, because heart surgery is one of the most complex operations on the human body, especially on newborn babies. If you can reduce the cost, you can change everything. Along with that, there are many things what you can do to make it happen. Next slide, please. First of all, as youngsters in health sector profession, you are wondering about the job opportunities you have. Believe me, economy of the 20th century was driven by machines which address the human toil. Economy of 21st century will be driven by health sector. Global healthcare and wellness industry is a $4.5 trillion industry. It is the second largest industry in the world after agro industry. This is the industry which is going to create a stable world. Why? Because the entire unrest in this world today is because of lack of well-paying jobs. In the last 10 years, this world has seen a lot of affluence. We see in the paper people becoming millionaires and billionaires, but money is in the hands of very few people. There is a huge gap between the rich and the poor. How do you make poor people rich? You can't distribute wealth. You have to give them a skill and pay them well. In my country, IT industry gets a lot of support from the government. For $250,000 turnover in IT industry, they need to hire just 5 to 7 people. For $250,000 turnover in healthcare industry, we need to hire 250 people. IT industry hires engineers who come from affluent families. Health sector hires nurses and technicians who generally come from lower socioeconomic strata. If you want equitable growth in the society, create jobs. And there is only one industry which can create that many jobs in this world, that is health sector. The National Service, I'm sure you are aware of all the criticism on National Health Service of United Kingdom. I was interacting with the policymakers of Britain. I told them that you have so many grievances against NHS. Why don't you close NHS? What will happen? They said, if you close NHS, people are going to die. I said, nothing is going to happen. If you close NHS, your economy will collapse. because NHS of England is the third largest employer in the world. This is the one which keeps the economic engine of England going, and this is the importance of health sector. Next one, please. Next. India requires 2.5 million heart surgeries a year. We are genetically 3 times more vulnerable for heart attack. In India, heart disease is not the disease of the old retired people. In England, average age of my patient was 65 years. In India, it is 45 years. In my practice, it is not the young son bringing his old father for a heart operation. It is the old father bringing his young son for a heart operation. We need to do 2.5 million heart operation. Now, you will be surprised to know that, next slide please. Next slide. All the heart hospitals in the country put together, less than 100,000 heart surgeries. In the process, what happens? What happens the rest? They gradually die over a period of time. India has the unique distinction of producing the largest number of young widows in the world. Next one, please. Now, don't take pity on India. 100 years after the first heart surgery, less than 10% of the world's population can afford heart operation. 90% of the world's population cannot afford a heart operation, brain operation, complex kidney operation, or a joint replacement. Something is drastically wrong with the way this industry runs. We have to address it. Next one, please. The mess we are in because our country spends less than 1% of the GDP on healthcare. Half the population of our country either borrow money or sell assets to pay the medical bills. Next slide, please. What is the root cause for global crisis in healthcare? It's because policymakers across the world believe that taxpayers' money can pay for the healthcare. Unfortunately, taxpayers' money by the government cannot pay for the healthcare. It could pay for healthcare 20 years ago when people retired at the age of 60 and they died at the age of 65. Today, people retire at the age of 60 and they celebrate 95th birthday. People are going to live longer, not working than working. Then where are the taxpayers? We have to dramatically change the way the healthcare is funded. What is the method? Next one, please. We believe that India will become the first country in the world to dissociate healthcare from affluence. 10 years down the line, we will have a very interesting scenario in India where millions and millions of people will still live in the slums with no amenities, but when they are unwell, they will have access to high-tech healthcare with dignity. How India can make it happen? Next one, please. Because we produce the largest number of doctors in the world. We produce close to 40,000 doctors a year. United States of America produces 16,000 doctors. We produce the largest number of nurses in the world. We produce the largest number of medical technicians in the world. Outside US, we have the largest number of US FDA-approved drug manufacturing units. We have everything required for a phenomenal healthcare delivery system. But something is missing. Next one, please. People do not have the cash money to pay for the healthcare. So 10 years ago, we conceptualized a scheme called Yashaswini. We coined a term called micro health insurance. We convinced 1.7 million farmers to pay 11 cents per month. In our currency, it is 5 rupees. We chose 5 rupees because that is the price of a packet of BD they smoke. We told them that one day in a month you don't smoke, you pay this 5 rupees. And the state government decided to become a reinsurer. And with that money, they can get any operation done on the heart in any of the 400 network hospitals of the state. And that program became a big success. And in the process, we realized that people are willing to pay. Today we have 4 million farmers paying 10 rupees per month, and with that money we are able to run a successful micro health insurance program. Now we are trying to convince our policymakers for covering the whole country with the micro health insurance. But how do you do that? We have 900 million mobile phone subscribers who are spending 150 rupees per month just to speak on the mobile phone. So we are making a policy where every mobile subscriber, if he can pay 20 rupees with his mobile phone bill, we would have solved the entire healthcare problem of our country. Poor people in isolation are very weak, but together they are very strong. Strength of the government is not in doling out the money. Strength of the government is making the right policies and implementing it. Then you will notice that the wealth of the nation has nothing to do with the quality of healthcare. Next one, please. We believe that all our state governments in the country will become health insurance provider rather than just healthcare provider. Looking at the success of Yashaswini Microinsurance, we launched. Our neighboring government called Andhra Pradesh launched a program called Rajiv Arogya Shri, and they won the election. Looking at the success of that program, neighboring government Tamil Nadu launched an insurance called Kalangar Insurance. Then Karnataka state launched another insurance called Vajpayee Health Insurance. There is something similarity in all these insurance programs. Do you know what the similarity is? All of them are named after the politicians. Politicians across the world do the right things for the wrong reasons. Next one, please. Now, when this major shift happens, when everyone can pay for the health care, where are the hospitals? We are running short of 2 million hospital beds, and the country simply doesn't have that much of money to pay for these building hospitals. So 1 year ago, we started working with India's largest construction company to change the way the hospitals are built. And this is such hospital which is coming up in a place called Mysore, which is 300 kilometers from Bangalore. The mandate given to this company and my team is to build and equip a 300-bed heart hospital for $6 million. Traditionally, it cost $25 million. We wanted to do it in $6 million. And we wanted this hospital to be built in 6 months. Normally, it takes about 3 to 5 years to build a hospital. And the first project will be commissioned next month. And we are instead of 6 million, we have spent 7 million, and it has taken us 9 months to build. And in this hospital, nursing care is not provided in the ward by the nurses. The nursing care is provided by the spouse. No nurse in this world can be as better nurse as a spouse. We have worked with Stanford University to develop a curriculum of 4 hours of audio-visual, how to train the spouse to be a nurse. This hospital has no central air conditioning. Central air conditioning doesn't prevent infection in a hospital. It is the commonest source of infection. Best sanitizer for a hospital is fresh air and sunlight. And this is the way we have built the hospital. This is what you people should think. Think out of the box. Think about what is relevant to the poor people. Poor people are not enamored by the marble flooring and the central air conditioning. They want to see the compassion in your face. They want your skill taking away the pain. That is more precious than any of the extravaganza you are going to offer. Next one, please. The next big cost of hospital is the cost of medical equipments. All the major medical equipments sell you the medical equipment, CT scan, MRI, PET scan, millions of dollars, and after 5 to 7 years, they refuse to offer the service so that you have to buy a new machine. How much money we can spend on the machines? We fly a plane which is 30-year-old and junk a CT scan which is 6-year-old. That is not acceptable. So we tied up with a company called TriMedics from US, which is United States' largest medical equipment maintenance agency. And they are going to extend the life of our medical equipment from 7 years to 14 years. This will reduce our cost significantly. Next one, please. How technology helps. 7 years ago, we started liver transplant on babies. We have great surgeons, but our anesthetists didn't have the expertise. Through the satellite, we linked our operating room from Bangalore to Children's Hospital of Philadelphia, and the anesthetist sitting there could anesthetize a liver transplant baby at our hospital. So they held the hand of our anesthetist for 5 to 6 operations. Today, we are doing liver transplant on babies with nearly 100% success. Next one, please. How are we reducing the cost of heart operation to $800? Interestingly, as young people, you all have to know that you are going to work in some hospital. No hospital in this world knows how much it costs for anything you do in the hospital. Healthcare industry is a very inefficient industry. We invested heavily on technology. We have an Oracle ERP solution. We have 14 hospitals in 11 cities. At 12 o'clock in the afternoon, all the senior doctors of our organization get a SMS with yesterday's revenue, yesterday's expenses, and yesterday's EBITDA margin. We know exactly how much money we spend for everything what we do. For us, looking at the profit and loss account at the end of the month